So our primary patient populations are dogs and cats. We don't have an exotic specialist here at this time, so it's really going to be dogs and cats. Then occasionally we get an animal from the Denver Zoo, but it's going to be, I'd say 75% of our caseload is dog and about 25% cats at this point.
Well, one of the primary differences, of course, we're treating animals, so the anatomy is different. While like for humans, like if we're treating an adult human, like the sizes are about the same and anatomy is similar. But for animals, we treat anywhere from between like a Chihuahua to a Great Dane, and with vastly different anatomies, and we have challenges associated with the small and the large. Another issue we have is animals have fur. So for humans, we put marks on the skin usually to localize, but with fur it makes it challenging. And usually, as opposed to humans, like when we're treating animals, they're under anesthesia all the time. If it's a simulation and treatment on the same day, you have to work really fast.
So I think our patient population is different from human medicine, where they're under anesthesia. So that's a big part. And a lot of, I think, coaching goes up front with clients about the anesthesia involvement in treatments. Because when I sit down and tell a client, I'm going to anesthetize your dog daily for 4 weeks, the eyes get big and we kind of go into panic mode. And so our typical patient, there's a lot of education that's happening up front in their initial consults, talking about the treatments. And once, we get into the actual treatment process, patients are dropped off in the morning. They all come in usually at a set time. Depending on if they have an anesthesia port already placed or not, they get their IV catheters placed for their week of treatment or the day of treatment. And then we kind of set our lineup dependent on organizing with surgery and chemotherapy. Sometimes even just my schedule for new starts. And then those patients, are brought down to the linear accelerator where they're anesthetized in the vault. All their anesthesia monitoring equipment goes on. That actually takes up the bulk of the time. So humans, when you only have to worry about your beam on time, we have our patients coming in under anesthesia, all the monitoring equipment, and then we also will generally do a cone beam CT for positioning for all of our patients. And then most treatments are either going to be a 7-field arrangement or a rapid arc type of treatment. Sometimes we'll do 3D conformal, and then those patients are under anesthesia for about 15-20 minutes of treatment. And then they wake up pretty quickly because our drugs that we're using are fast acting. And so most patients 30-45 minutes after treatment are munching on their brunch, and then 1 to 2 hours after treatment are ready to go home.